So hello, good evening dear students. Welcome to BAJIRAO IAS Academy, the Hindu News Analysis. So today is 10th of April and in this lecture we have come up with few important news articles. So we will try to understand the crux of those news articles. We will also try to understand what exactly those news articles are talking about and how we can link them with our prelims and main syllabus. So before starting the discussion, please try to subscribe our YouTube channel and also hit the like button. Okay, so before discussing them, let's try to solve yesterday given practice question. So yesterday I've given one practice question, that is with respect to the green hydrogen. As I have already told you that hydrogen is one of the most important renewable energy. We have a lot of climate commitments, and apart from climate commitments, we also wanted to reduce our dependence on fossil fuels. However, the green hydrogen can be one of the most sustainable alternative to the fossil fuels. It reduces emissions and it will also reduces the pollution into the environment. So therefore, the correct answer for this question with respect to green hydrogen is it is generated through a renewable energy, a process called electrolysis through renewable energy sources. So the correct answer for this question is option C. See, there are different ways through which hydrogen can be produced. For example, when we talk about the grey hydrogen, so this grey hydrogen uses fossil fuels. The grey hydrogen uses fossil fuels for the production of hydrogen. And on the other hand, when we talk about the other form of hydrogen, that is blue hydrogen. Okay, so when we talk about blue hydrogen, natural gas is being used to generate hydrogen. However, the emissions that are being generated while producing the blue hydrogen can be captured and stored safely. So because of that reason, it is known as blue hydrogen. And the other form of hydrogen is known as green hydrogen. So in green hydrogen, it is produced through the energy which is being used for electrolysis. Okay, so through the process called electrolysis, hydrogen is being produced. Okay, so in this electrolysis process, renewable energy is being used, so therefore the emissions would be zero. Emissions would be zero, and the production of hydrogen is also sustainable and it is also eco-friendly, and because of that reason the government has been emphasizing on the green hydrogen. The correct answer for this question is option C. So here different hydrogen types are being given. So firstly, when we talk about the black hydrogen, so the black hydrogen is extracted from the coal. Now please understand, coal is also a form of fossil fuel. When fossil fuels are burnt, they emit carbon into the atmosphere. Now please understand, carbon is one of the potential greenhouse gases, so therefore carbon significantly increasing the temperature of the atmosphere, and that has been further leading to the climate change. Secondly, when we talk about the grey hydrogen, so this grey hydrogen also uses fossil fuels. Okay, so grey hydrogen uses fossil fuels to generate hydrogen. When they are using fossil fuels such as crude oil and other forms of fossil fuels, they release again carbon into the environment. So carbon is, we know that it is a potential greenhouse gas, and this greenhouse gas has been contributing for the climate change. So on the other hand, how blue hydrogen is different from grey hydrogen? Because blue hydrogen also uses fossil fuels for the production of hydrogen. But how the blue hydrogen is actually different from grey hydrogen is actually, in production of blue hydrogen, the emissions would be captured and then stored safely. Okay, so the emissions would be captured and stored safely so that the emissions would not enter into the environment and they would not increase the temperatures of the atmosphere. So because of that reason, blue hydrogen, even though it comes with emissions and even though it uses fossil fuels, it is also considered as one of the sustainable methods of producing hydrogen. So on the other hand, green hydrogen does not use any fossil fuels. Rather, it uses the renewable energy which is being produced from wind energy, solar energy, so those things. So therefore, the wind energy and solar energy are also produced without using any fossil fuels. So therefore, the energy resources which are being used in production of green hydrogen doesn't come up with any emissions or any pollution. So hence it is known as a green form of hydrogen, and it is sustainable form of hydrogen, and at the same time eco-friendly form of hydrogen. Okay, so please understand, the hydrogen is same in every method, but the method of producing hydrogen is different, because in some methods fossil fuels such as natural gas is being used, coal is being used. Okay, so the methods are different, but hydrogen as the end product is same in all these types of hydrogen. So next question for today is that which one of the following is the nodal authority which is responsible for accrediting agencies for monitoring, verifying and certifying the green hydrogen production projects in India. So the options given here are Bureau of Indian Standards, Commission for Additional Sources of Energy, Bureau of Energy Efficiency, and Indian Renewable Energy Agency, Indian Renewable Energy Development Agency. So please answer this question in the comment section, and correct answer I'll be providing you in tomorrow's lecture. So let's try to discuss the first very important article. So this article is also with respect to the climate change and its impact on women. Climate change and its impact on women. So this essentially means that we all know that climate change is one of the potential threat the world has been facing. But the author has been suggesting that the climate change would have exorbitant or excessive impact on women. So women are more vulnerable to the climate change compared to the men. Okay, so that is what the author's concern here. So the impact of climate change on women's health women's health and well-being, as well as the importance of incorporating the gender sensitive approaches into the climate action plans have gained a lot of prominence in recent discussions. So this essentially means that climate change is having negative impact on women health and women well-being also. So therefore, in this context, there are certain gender sensitive approaches that will deal with the climate change, so that the negative effect of the climate change on women can be significantly reduced. So women is categorized as a vulnerable group. And if you look at the impact of climate change on various sections, women are most affected and they are most vulnerable group of people to the negative impact of climate change. So therefore, in this context, the author has been suggesting that there is a need for gender sensitive approaches or gender sensitive policies, and those gender sensitive policies would take into account the concerns or the challenges that the women have been facing due to the negative impacts of climate change. So this is what the author has been talking about. First and foremost, how climate change impacts the health of women, how it is being associated with the health risk of women. Okay, so firstly, it is said that women and girls face disproportionately a high health risk due to climate change. So if you look at the impact of climate change on women health, women are one of the most affected and most vulnerable group of people, and it will also impact their health care. So particularly in impoverished situations and influenced by various other cultural norms. Now I can give you example for this. Imagine climate change has led to the drought-like conditions, and climate change has also led to the erratic rainfall in one particular region. So due to this erratic rainfall, women have to walk long distances to fetch water. Potable drinking water. And in this process, women's health may gets impacted, and women, especially the girl students, may not attend the schools, and it also impact their learning outcomes. And we should also talk about the pregnant women and lactating mothers, because they also need to fetch waters walking long distances. So therefore, this is one example that has been proving the fact that climate change makes women are more vulnerable. And after that, we should also talk about climate change impacting the rural incomes of the people. So there is no doubt that due to climate change and again erratic rainfall or due to floods, crop failures in rural areas is a phenomenon. A regular phenomenon. Crop failures in rural areas have becoming a regular phenomenon. Now, due to crop failure, you need to talk about the income. So incomes of the households. So incomes of households would be drastically reduced due to the crop failure. So when their incomes are got reduced, they will not be able to purchase the LPG cylinders. Even though the government has been providing subsidy, in recent times the government has substantially decreased the subsidy amount. So when they are not able to purchase these LPG cylinders, then they must depend on the traditional firewood stoves. So these firewood stoves certainly have a lot of negative impact on the woman health care. So see, understand, everything is interlinked. Now in this case, I can give you another example. Imagine another case. In rural areas, due to erratic rainfall or due to excess floods, so that leads to the failure of the crop. So after the failure of the crop, one option they have is migration to the nearby urban areas. So when they migrate to nearby urban areas, their living conditions are very often poor. Okay, so very poor living conditions they actually face. Now in this context, women also becoming more and more vulnerable because of poor sanitation and hygiene that the woman would have in those urban areas, because they very often end up in urban slums, and urban slums are known for lack of drinking water, safe drinking water, poor sanitation and hygiene. So this also comes with a lot of contagious diseases for women. So this is how the climate change has actually impacting women at different levels, and this is the real concern of the author in this article. And in fact, the woman has also suggesting that women and children are significantly more impacted, or they are more vulnerable than men. Okay, so if any climate crisis took place, there is a higher likelihood that women and children would die compared to men. So because they are more vulnerable to those disasters, the climate driven disasters, so that has been revealing the fact that women would have the higher chances of dying because of these disasters. So therefore it has been emphasizing on the gendered impact of climate and related or associated events. So not just this, so we should also talk about the agriculture and nutrition linkages, income and nutrition linkages of rural women. So those things we should also understand when we are talking about the impact of climate change on women. So after that, a very important concept, that is the impact of climate change on food security. So we all knew that India's total population has become already 142 crore people. Now, increasing population has actually puts pressure on food security or available food sources. So therefore, in this context, as such a huge population, we must ensure food security. So it should not result in food insecurity. So therefore, climate change, we all well knew that climate change has led to either floods or droughts, reducing the agricultural productivity because of the increased attacks by pests and diseases. So all these factors have been increasing the chances of hunger, malnutrition. So due to hunger and malnutrition, it is also estimated that the woman would be more impacted than men. Now if you look at the total number of women who are malnourished and who are also facing the iron deficiency. It is said that around 2/3 of women have been facing this iron deficiency. So in this context, when iron deficiency is at a very high level and women are also facing problems like malnutrition, you should also think about the maternal mortality rates and infant mortality rates. Okay, so if there are higher maternal mortality rate and higher infant mortality rate, so the country would not see the higher levels of human development. You cannot expect higher levels of human development when on the one hand there are higher levels of maternal mortality rate and infant mortality rate. So therefore, after that we should also talk about the healthy children. So for example, the iron deficiency facing woman give birth to a child, so the child would also face the problem of malnutrition, and he would increasingly face various diseases would gets impacted, and in fact his learning outcomes would also become significantly reduced. So there will be a multiplier effect because of climate change on women and children. So here the author has been saying that the climate driven factors or climate change has been significantly reducing the food production or crop yields, and when crop yields are lesser, that increases the food security. Okay, so when the food security problem is increased or food insecurity is increased among the existing population, especially the poor population, and especially among women who are living in rural areas, then it creates a lot of negative impact on the social and economic development in rural areas, because particularly women in rural areas are vulnerable to those negative impacts. So after that we should also talk about the impact of climate change on the physical health of the woman. So in recent times, heat waves becoming a very common phenomenon that we have been observing. So due to heat waves, so they will have a higher impact on vulnerable groups such as pregnant women and young children and even the elderly women. So all these factors have been highlighting the need for targeted interventions that are required to mitigate these health risks. See, the author has been suggesting that climate change have a higher negative impact on women. So therefore, you need to come up with appropriate solutions to deal with the negative impact of climate change on women and children. So that is how you can save a woman from the negative impacts of climate change. So how can we empower women in climate action? So how can we make women part of the climate action? So that is also a very important and first and foremost thing that we should consider is a gender sensitive approaches. So gender sensitive approaches is that we must identify and recognize the impact of climate change on women first. So when we understand the impact, then we can come up with appropriate gender sensitive approaches or appropriate gender sensitive policies, because they are very often essential for ensuring effectiveness and inclusivity in the mitigation and adaptation measures. Now in this context, climate change is a reality. So since climate change is a reality, we must focus on mitigation and adaptation of climate change. Now here I will tell you what exactly is mitigation of climate change. So mitigation of climate change is that reducing the negative impact of climate change on various sections of the society, especially the below poverty line or vulnerable group of people. And when we talk about the adaptation in climate change, so please understand, increasing temperatures due to climate change has becoming a more common phenomenon. So here adaptation means that we need to grow less water intensive crops, and at the same time we can shift ourselves towards pulses and cereals. So these pulses require a less irrigation, and they also require lesser amount of fertilizers, and they are also resistant to higher temperatures. So here what we are doing, we are increasing the incomes of the farmer on the one hand, and at the same time we are also ensuring the food security and the nutritional security for our populations, and we are also continuing our agricultural practices despite there are higher temperatures. So this is the example of adaptation, and mitigation is reducing the negative impacts of climate change on various sections of the society. And secondly, we must empower women so that they can be able to withstand the negative impact of climate change, and they could also mitigate and adapt to the changing climates. So they will not be more vulnerable that we have discussed earlier. Okay, so we need to provide access to resources for women, and we should also empower them to make crucial and key decisions with respect to their families, with respect to their livelihoods. So we must empower women to make such crucial decisions. So that can lead to a better climate solutions, increased agricultural yields, and enhanced community resilience also. Because please understand, if you look at rural areas, majority of the labor force or workforce engaged in agriculture sector was a woman. So therefore women have a lot of potential to increase the agricultural yields, and they can also enhance their resilience to the existing climate change and its negative impact. So we must look at empowering women, both financial empowerment and at the same time the technological empowerment and social empowerment and political empowerment. So the holistic empowerment or inclusiveness in the empowerment approach is very important, that will help ensure the desired objective of reducing the vulnerability of women. And after that, we must look for the local level interventions. See, local level interventions are very important. Now here, local level interventions actually means that, at the village level, at the panchayat level. So they are driven by women collectives and participatory approaches. Okay, so they can facilitate innovative solutions to climate challenges and contribute to the sustainable development goals. So they can contribute to the sustainable development goals. So please understand, women are actually one of the important components of this sustainable development goals. So we cannot achieve the sustainable development goals without the active participation of women. So therefore that is very important here. So the next important news article is with respect to the tuberculosis or TB. So in earlier lectures also we have discussed about the tuberculosis, right? So tuberculosis is one of the most contagious disease. Okay, so it is one of the most contagious disease. So that has been spreading at a faster pace. Now if you look at the TB statistics, TB is more prevalent in countries like India, especially countries in South Asia, because of poor health and poor healthcare infrastructure. So that has made the faster spread of TB. And apart from that, the TB is caused by a bacteria called tuberculosis. Okay, so it is caused by a bacteria called tuberculosis, and this particular bacteria has also developing the resistance, antimicrobial resistance, AMR. So since it has been developing this antimicrobial resistance or resistance to existing drugs, those drugs are very often becoming less effective to the TB disease, and that has been making the TB disease chronic, and even some cases it leads to the large scale mortality also in a countries with a higher population and higher spreading rate of tuberculosis. However, even though it is being associated with the mortality, we should also talk about the other issues that are being associated with the tuberculosis, because it impacts the livelihoods of the people and it impacts the income of the people, and in fact very often discriminated in the society, discriminated in the family also. So they're being increasingly stereotyped. So they increasingly stereotyped in the families and in the societies. So therefore this has been pointing out to the fact that it requires a multi-pronged approach. So when I say multi-pronged approach, we need to take into consideration the different approaches that are being available, and we should also look for the different stakeholders. So who can play a significant and important role in eliminating TB from a country like India. Now first understand the context. So context is that India struggled to eliminate tuberculosis because we have a goal to eliminate tuberculosis by the year 2025. So we are already in 2024, so just 1.5 years left to eliminate TB successfully from India. Okay, so in this context, so this ambitious goal was announced by Prime Minister Narendra Modi. So this is also known as TB Mukt Bharat by 2025. However, this goal may not be achieved because of certain reasons. So those reasons are shortage of TB drugs. So there's a huge shortage of TB drugs. That is the first reason, and particularly drug sensitive TB patients. Okay, a shortage of TB drugs making this TB spread further, enhancing the TB spread. So first and foremost, we need to talk about the shortage of TB drugs, tuberculosis drugs. So it is said that India has been facing the shortage of tuberculosis drugs. So that include critical medications for drug sensitive and multi-drug resistant tuberculosis patients. So when the drugs are not available for the tuberculosis, that impact or hinder the treatment initiation and its success also. Secondly, we need to talk about the preparedness to deal with the tuberculosis. So there is no doubt that we have announced that India will eliminate tuberculosis by the year 2025. But in order to eliminate tuberculosis, preparedness is also very important. But when we don't have the drugs available for the patients, so how can we eliminate TB disease by the year 2025? And that is a critical question that we need to answer here. And that is why it says preparedness is very often questionable, because still we do not have the basic facilities such as drugs or any other basic elements, so that are helpful and effective in eliminating or reducing the spread of tuberculosis. And after that, we should also talk about the existing efforts that are being taken by the governments to deal with the tuberculosis. In fact, those efforts are also not giving the results, the desired amount of results. Why? Because the shortage of TB drugs are actually undermining the efforts to address the gaps in TB care, and at the same time it also delays the diagnosis, treatment initiation and achieving the treatment success also. See, when a person is being infected with the tuberculosis, when the tuberculosis is not diagnosed immediately after he is being infected, then it is very difficult to cure the disease in the later time. And in fact, even if you administer drugs for the infected person, the TB would become chronic and it will have a lot of negative impact on the infected individuals. So therefore, when we talk about TB elimination, diagnosis plays a very important and a very prominent role. However, you can clearly see that there is a delay in the diagnosis. And when there is a delay in the diagnosis, the treatment will not be initiated immediately. So that is another factor, because they require immediate treatment initiation once they are infected with the tuberculosis. And that results in lesser treatment success also, because you are initiating treatment at a later phase, so that will significantly reduces the treatment successes. So all these factors have been posing significant challenges when it comes to dealing with the tuberculosis disease. And after that, we should also talk about the inadequate management and response to this TB or tuberculosis disease. So it actually requires a proper and careful management of the disease, and that is very important. In fact, the government recently made a decision. So the decision was, it has been renaming National TB Control Program as the National TB Elimination Program. Now, just simply changing the name of earlier existing policy or the program will not help you to eliminate the TB disease. Rather, it requires proper management of the disease. It requires the preparedness to deal with the disease and its spread. you have to have adequate infrastructure to immediately diagnose and initiate the treatment for the disease, and that is very important. But just simply changing the name would not be impactful in eliminating TB disease from India by the year 2025. Okay, so therefore we need to look for the fundamental issues in addressing TB challenge. So the fundamental issues, earlier also we have understood, there's a drug availability issue and inadequate management issues with respect to TB, and therefore all these factors need to be considered when we are planning and designing any policy or any program to eliminate TB from India. So no doubt that we must eliminate tuberculosis from India by 2025. So even if we do not achieve this goal, even if we are not able to achieve this goal, so we must be able to plan proactively to deal with the TB disease and make sure every stakeholder is part of the decision making. So after that, there are also a lot of logistical issues. So logistical issues means that in fact recently the health ministry has very often given the last minute permissions for various states for local drug procurement. So that has created a lot of logistical challenges. Okay, so there will be a scarcity of the transportation, okay, at the field level. So that has been further increasing the problem of drug shortage. And after that, we should also talk about the required measures that must be taken. Okay, so when we talk about these required measures, addressing the recurrent shortage of TB drugs and improving the overall management of the national TB program. So they are very important steps that must be taken to enhance the existing India's efforts towards eliminating the TB disease. So these recurrent issues must be sorted out. Solutions must be found out for these issues so that we can move forward in achieving the larger goal of TB Mukt Bharat by the year 2025. Okay, so this is what the author has been suggesting here. And next important news article is with respect to the solar photovoltaic cells and solar photovoltaic cells and recent import restrictions by the government on solar photovoltaic cells. Now please understand, the solar photovoltaic cells plays a very important role in converting the heat energy from the sun or generating the solar energy. Heat energy from the sun would be converted into electricity by these solar photovoltaic cells. So however, majority of these solar photovoltaic cells are being imported into our country from countries like China. So when we are increasingly dependent on imports for these photovoltaic cells, so that will not develop the domestic manufacturing base, because developing a strong manufacturing base for these photovoltaic cells is very important, especially in the backdrop of increasing importance for the renewable energies, in the backdrop of India's commitments, India's climate commitments. So therefore, in this context, recently the government has imposed import restrictions in the sense that the government will increase the customs duty. Government will increase the customs duty on the import of these solar photovoltaic cells. So when they have the higher customs to import these solar photovoltaic cells, and it ultimately reduces the imported photovoltaic cells. And it is also expected that the government would undertake various measures, and those measures would result in further strengthening the existing photovoltaic cell manufacturing base in India. So that is the overall objective of importing restrictions. Okay, now what is the context? The context is that the government recently reimposed restrictions on import of solar modules. Okay, so it has imposed restrictions on import of solar modules. So this particular move was taken to boost the local manufacturing, as domestic manufacturing capacities are now ready to meet the demand and need to be supported. So whatever I have explained here is mentioned in the context. it is saying that the government has reimposed restrictions on the import of these solar photovoltaic cells. So why? Because the government wanted to encourage and promote domestic manufacturing base of these solar photovoltaic cells, because there is a huge domestic demand, and if we are able to encourage and promote the domestic solar photovoltaic cell manufacturing units, so they create a lot of employment opportunities, and India can also become an export hub. And at the same time, in the long term, India will not depend on any country for the import of the solar photovoltaic cells. So that essentially means that achieving the Atmanirbharata or the supply chain resilience, and that is very important here. Supply chain resilience. Now please understand this in a detail. So there is a need to focus on solar power generation in India. So why there is a need to focus on solar power? So first and foremost, we have a lot of targets. For example, under Mission Panchamrit, so one of the goals was generating 500 gigawatt of renewable energy by the year 2030. And in fact, if you look at the total renewable energy generation capacity, the capacity of solar energy generation is very high. Okay, so therefore the solar energy is considered as a driver of this particular goal, and in this context we require a strong solar photovoltaic manufacturing base, and that is very important. And secondly, in recent times, the energy demand in India has been significantly increasing because of rapid economic growth. So one reason, rapid economic growth, and at the same time increasing the electricity usage of consumers, industries. So all these factors have been rapidly increasing the demand for the electricity or energy. So it is also expected that by the year 2030, the total energy demand in India would increase by around 40%. So in order to meet the increasing energy demand, we cannot just produce electricity from the existing thermal power plants. We also require a large scale adoption to the solar energy. So this is also another reason that we need to focus on the solar power. And after that, we should also tap the potential of solar energy. According to an estimate, it is said that India has the potential of generating around 748 gigawatt of electricity from the solar energy itself. Because understand, India is a country which is located in the tropical belt, and there is also a higher probability that India would receive sunlight throughout the year. So that makes India has a lot of potential to produce the solar energy, and in this context we must encourage the domestic manufacturing industry to utilize the existing or to tap the potential of generating such heavy amounts of electricity. Now in fact, if you look at the total installed capacity of India's electricity is around 480 gigawatt, but see the potential, it is 748 gigawatt. So that essentially means that we can produce all the electricity from the solar energy itself. So that has also been indicating towards the fact that in future there will be a huge demand for these solar photovoltaic cells. So after that, there are a number of efforts that are being made by India to promote the solar photovoltaics. So what are those attempts? Okay, so we have excessively dependent on other countries for these solar photovoltaics. So in order to reduce this dependence, India has made 3 significant efforts in the past 5 years. So we all know about the production linked incentive scheme. So this production linked incentive scheme is actually extended to various products. So solar photovoltaics is also one of the sector where the PLI scheme is being extended. So the government has proposed 19,500 crore of production linked incentive scheme in the union budget 22-23. Okay, so this budgetary allocations to scale up the domestic manufacturing of entire solar supply chain from polysilicon to solar modules. And after that, the government has also significantly increased the customs duty on both polysilicon and solar modules. So increasing the customs duty by the government on these items would reduces the imports of these solar photovoltaics, and at the same time it will also boost the domestic manufacturing of these photovoltaic cells. So we knew that, I have already told you that there is a higher dependence on countries like China to import these solar photovoltaic cells. So first we will try and understand why China is China is actually having a leading position as an exporter. First and foremost, cheap power supply to the industries. So this is one reason. Cheap power supply to the industries. So China is in fact a most cost competitive location to manufacture all components of solar photovoltaic supply chains, because of a lower cost of power supplied to the solar industry. So they require a lot of power, and the power is being supplied by the Chinese government at the lower cost, at the subsidized cost, because it is said that electricity accounts more than 40% of the production cost of polysilicon and 20% of the other items or other elements which are used to manufacture these panels. Since power plays a very important role, Chinese government has been supplying a huge quantities of power at subsidized rates, and that is the one advantage. And after that, China has also recognized solar photovoltaic manufacturing as the strategic sector. Okay, so Chinese policies are actually prioritized solar photovoltaic as a strategic sector, and growing domestic demand also enabled the economies of scale and supported continuous innovation throughout the supply chain. So all these factors coming together has led to the robust growth in the solar photovoltaic manufacturing, and China has also established itself as a export hub of these solar panels. So the next important news article is with respect to the telemedicine. Now recently, telemedicine has actually emerged as a viable alternative to the in-person consultations with doctors in many contexts. Okay, so there is no need to consult a doctor in person. Rather, we can simply use existing information and communication technologies. So with the help of the information and communication technologies, you can interact with the doctor on your mobile phone, on your laptop. Okay, so that is known as the telemedicine. So telemedicine has a lot of advantages, but first we need to understand what exactly the World Health Organization has said with respect to the telemedicine. So the World Health Organization has defined telemedicine as the delivery of healthcare by using the information and communication technology in exchange of information for diagnosis, treatment and prevention of the disease. For example, imagine that you are an individual and you no need to go to the hospital for the consultation. So through the information and communication technology, through your mobile phone, you can directly call talk to the respective doctor. But in return, you must provide the details, the information for diagnosis and treatment and prevention of diseases. All those details would be exchanged between the doctor and the patient. Now, why telemedicine is important? So telemedicine actually cuts down one's one-on-one interactions. So there's no need that you can directly go to the doctor. So for example, in this case, imagine COVID-19 pandemic. Okay, so COVID-19 pandemic is a contagious disease, right? So this is a contagious disease, and if you are infected with the COVID-19 pandemic and you directly go for a physical consultation with the doctor would also face the risk of spreading this disease or infecting with this disease if you directly go to the doctor and consult it with him. But on the other hand, the telemedicine helps you make sure that the disease will not spread to the doctor and everyone are safe, and at the same time you are also getting the reliable health care from the professional. So that is the advantage of the telemedicine, and that is being highlighted by the World Health Organization. Now please understand the benefits of telemedicine here. So there are some benefits. First and foremost, it is very easy and time saving also. So because you don't need to go to the hospital, so you can directly talk to a doctor on your mobile phone and laptop. So therefore it saves a lot of patient time, and it will also save the expenses. You no need to go to the doctor, and that reduces the expenses or the expenditure you incurred while traveling to and from. Okay, so therefore it is most advantageous, and it saves your time and also your money. So if you look at India, in India 70% of the population lives in rural areas, but in rural areas the healthcare facilities are not adequate. So they have to travel to the nearby urban areas to get the healthcare services. But if we introduce telemedicine in a large scale, then those people will not be so there is no need to go to the nearby urban areas. So they can directly consult a doctor from their homes itself, sitting in the comforts of their home itself. Okay, so there will be no long distance travel to urban areas. And when they are traveling to those urban areas, it is also said that that also results in emissions of carbon, because you are traveling to somewhere else through your car, and that will contribute to the emissions. Okay, so after that, it will also significantly fills the existing gap in healthcare sector. So existing gap means most of the doctors, medical practitioners lives in the urban areas, but majority, around 70% of the population lives in rural areas. Okay, so there's a mismatch. So how can we fill a gap here? So telemedicine actually offers a potential solution for this. Okay, so most Indians live in rural areas, while most of the doctors operate from the nearby urban locations. So this actually leads to a gap in the healthcare access, so that can be solved through the telemedicine. And secondly, the economic impact also, because it saves a lot of money and a lot of time also. Okay, so that is another advantage. And we can also focus on the doctor population ratio next. In India, it is said that the patient and doctor ratio is very poor. The World Health Organization has mandated that there should be one doctor for 1,000 population, but in India it is 0.62 doctor for 1,000 population. Okay, so this gap can be managed through the telemedicine. So it is said that telemedicine can help making up the doctor population ratio. And after that, the population is expected to remain low in near future also. So therefore, in this context, this deficit is partly being made up by the active telemedicine services in various parts of the country. Okay, so this deficit can be filled through the telemedicine, active telemedicine services providing through the information and communication technology. Now, in this context, the government has launched various programs and various initiatives for telemedicine, affordable telemedicine for every citizen. And first such scheme was e-Sanjeevani program. So e-Sanjeevani is Government of India's free telemedicine service. Okay, so it is also a national level telemedicine service, and this aims to provide alternative to the conventional physical consultations via digital platform. Okay, so through digital platform you can directly talk to the doctor, and that is e-Sanjeevani. And after that, the government has also brought Arogyasri. Okay, so this is another internet based mobile telemedicine conglomerate. So that actually integrates multiple hospitals, mobile medical specialists, and rural mobile clinics. And after that, the government has also issued telemedicine practice guidelines under NMC Act of 2019. So this actually regulate telemedicine in India. So how it can regulate it? Providing guidelines and prescription protocols, responsibility of registered medical practitioners during the online consultations. Okay, so these are various initiatives that are brought by the government to deal with the telemedicine, to improve access to telemedicine for every citizen, thereby benefiting from the telemedicine. Okay, so that also helps in achieving the goal of larger universal health care. to every citizen. Okay, so that's all for today, and thank you so much. So if you really like our work, please subscribe to our YouTube channel and also hit the like button for this video, and thank you so much.